Hi there, hello. Welcome to the scope today. If you're watching the replay, thank you for watching. And if you're on here live today, then please say hello. Please stop by and say hi and introduce yourself. I am Dr. Vandna Jerath. I'm an OBGYN physician in Parker, Colorado. And it is a snowy day in Colorado today. Lots and lots of snow. There's a good storm here. So I braved the storm today and went to a gynecology conference today. It was called GYN Case Conundrums. And so what that means is that our colleagues present to each other puzzling or interesting gynecology cases with each other and try to see how things could have been improved on a certain patient case. And so one of the things that came out of the conference today was that a lot of the colleagues were frustrated by the fact that patients were coming in and Googling their symptoms or Googling possible treatment plans. So they essentially were using Dr. Google and thought that all the information they got on the internet was reliable. And so a lot of colleagues were frustrated and felt like it was limiting their care and their ability to properly counsel patients in this regard. So I, however, feel very differently. I think it is okay for a patient to Google and to use Dr. Google, but you need to do it in a reliable manner to make it productive for yourself. So 60 to 90% of people use the internet for their healthcare. How many of you guys use the internet for your health? Put a 1 in the chat if you are using the internet to Google your symptoms or to try to come up with treatment plans for yourself. And so 60 to 90% of people use the internet to Google or try to figure out what's going on with themselves for health-wise or health-related reasons. And so you just need to be reliable about doing that. You need to go to sites that are either like .gov or .org. Those are typically more reliable sites such as the CDC or WebMD, or you want to try to follow physicians like myself. There's a lot of us out here trying to educate patients and put reliable information on the internet, and you can get a lot of valuable and good information that way. And I think it's fine to do your research ahead of time and bring that research in to your doctor's office and present it. And then I think the way to open your discussion with your doctor is not to come in thinking that everything you got on the internet is accurate, but rather asking your physician to explain to you how or why something you read about or you researched may be a good option for you or why it might not be a good option for you. And I think that's the best way to have a productive conversation. I think it is a patient's right to research. I think it's a patient's right to have a second opinion. I know that a lot of my colleagues can find this frustrating, but I think it's very important to be empowered and educated about your healthcare. And so I commend you if you use Dr. Google. Just make sure you're using a reliable source. So, either doctors' websites, WebMD, CDC again, those are all good resources. If you're using a lot of university hospital sites, those often have a lot of good information as well. So if there's any questions I can help you out with, just let me know. Otherwise, I hope you'll consider sharing the scope. You can swipe up or swipe right to share it with others. And I will be back to share more info later. Thanks. Bye.